Hello, my name is Ashley and today we'll be discussing the results of my ongoing research project, which assessed the effects of pragmatic language therapy on communication skills within children with Asperger's syndrome. This past semester I've been externing at a local elementary school, and while there I completed an intensive pragmatic language treatment program with one of my clients. Today I will be reviewing my study and the results within this presentation. To see what the current literature has to say about the effects of intensive pragmatic language therapy, the following 3 scholarly articles were examined. The first article, written by Adams and Lloyd, explored the effects of speech therapy on children with a diagnosis of pragmatic language impairment. 6 children ages 5 to 9 received 3 intervention sessions per week for an 8-week period. All children in the study met the following criteria: a communication impairment range score on the Children's Communication Checklist, an absence of core autism, and a diagnosis of pragmatic language impairment. Pre- and post-therapy measures were taken using the assessment of comprehension and expression, the analysis of language-impaired children's conversation, and the clinical evaluation of language fundamentals. When comparing the pre- and post-test statistics, the results of the study show that there were measurable changes in pragmatic behavior in all 6 students following intensive speech and language therapy. Within the next article reviewed, authors Baxensale, Lockton, Adams, and Gale aim to collect and review the perceptions of teachers and parents regarding a treatment program called the Social Communication Intervention Project. In this study, 8 children with communication disorders received a trial of the SCIP intervention. The SCI intervention plan focused on language processing, pragmatics, social understanding, and social interpretation. 2 months following the completion of the treatment program, teachers reported increased performance in listening skills, comprehension monitoring, vocabulary, narrative work, attention skills, asking for help when needed, sequencing ideas, mathematics, and reading. Additionally, parents reported increased performance in discussing emotions, problem solving, and flexibility. The results of the study demonstrate the advantages of intensive pragmatic therapy both in school and within the home environment. Within the third article reviewed, authors Marison and Marison examined the effects of pragmatic language therapy on children's conversational repair skills. Within the study, children ages 7 to 11 years old were broken up into the following 3 groups. The PLI group consisted of children with a diagnosis of pragmatic language impairment. The SLI group consisted of children with the specific language impairments with no pragmatic deficits, and the mainstream group consisted of children with normally developing communication skills. Each child participated in a 6-week therapy program focusing on pragmatic skills for children with pragmatic language impairment. The results show that the children within the SLI and mainstream group demonstrated success in both task completion and initiating conversational repair. Additionally, the children within the PLI group also demonstrated improvement in both task completion and initiating conversational repair. The results of this study show that children with pragmatic language impairment have strong potential to develop and effectively utilize pragmatic skills they were explicitly taught through therapy. Within the current study, a single-subject ABA withdrawal design was implemented to evaluate the effectiveness of intensive pragmatic language therapy on the participants' social communication skills. The twice-a-week therapy program consisted of 12 30-minute treatment sessions. Baseline measures were obtained prior to the treatment plan, upon completion of 3 weeks of the treatment plan, and 2 weeks following the completion of the treatment plan within week 8. Outcomes for this study were measured and compared using the Pragmatics profile taken from the SELF-5. For the purposes of this study, we focused on the first section of the Pragmatics profile only, which assesses the participants' rituals and conversational skills. The profile was completed by the participant's classroom teacher and parent. JD was the participant in our study. He is a 10-year-old male in the 4th grade who currently has an individualized education plan. JD was diagnosed with Asperger's at age 7. He has been receiving speech and language therapy at school since the 2nd grade. He currently receives 30 minutes of one-on-one speech therapy 2 times a week. He currently does not receive any other outside treatment, but his classroom teacher and parent reports that he makes poor eye contact, has difficulty relating to others, and has difficulty understanding social cues. Therapy sessions followed the Simply Social 7 at School resource book that includes the following for each social skill. The Simply Social 7 Steps page provided a set of 7 practical steps for JD to think about while working on each specific skill. The Look and Learn page shows a cartoon scene illustration that depicts students who are using the skill appropriately and inappropriately. JD used this cartoon to identify the skill he was working on and to discuss what the students in the scene were doing correctly and what they could improve upon. The Think and Review page presented JD with different social situations in the classroom, at school, at home, or in the community, and was asked to use his reasoning skills to identify good choices and bad choices. JD used this page to discuss what the students in the situations should do next or what they could do differently. Finally, the take-home practice page allowed JD to inform his parent what skills he was working on. The page provided his parent with a practical way to review the social skill with JD and gave him a way to reinforce what he had learned in therapy. I will now be discussing the general procedures for our study. The initial baseline, or A phase, occurred during week 1 of the intervention program. During this phase, the participant's classroom teacher and parent each completed the Pragmatics profile. Treatment occurred within the B phase. The Simply Social 7 treatment plan was utilized, focusing specifically on conversational skills. Other materials, such as conversational starter cards, picture cards, videos, and social scripts were used to supplement the Simply Social resource book. Within this phase, the Pragmatics profile was again completed and scored during week 3 of intervention. The final baseline, or withdrawal A phase, occurred 2 weeks after the treatment plan was concluded. The participant's classroom teacher and parent completed the Pragmatics profile one last time. The following graph depicts the effects of the treatment program. JD received a score of 32 from his teacher and 34 from his parent on the Pragmatics profile as his initial baseline. JD's scores showed improvement by week 3 and continued to show improvement throughout the entire treatment duration. JD's final baseline scores were 42 from his teacher and 45 from his parent. This graph demonstrates that intensive pragmatic language therapy did significantly improve JD's pragmatic language skills. Within this study, limitations included the limited availability for naturalistic therapy. All treatment sessions were conducted in one-on-one pull-out sessions. Although the treatment plan was designed for one skill to be targeted per session, weather-related school closings resulted in sometimes targeting multiple skills per session. The short therapy duration of 30 minutes also limited the time spent on each skill. At the beginning of this presentation, I reviewed 3 research articles detailing the effects of pragmatic language therapy in children diagnosed with pragmatic language impairment. Children with PLI have been clinically defined as children who have seemed to have normal language development, however have unusual language constructions, difficulty using pragmatic cues in conversation, difficulty in turn-taking, and complex difficulties with comprehension. However, children with PLI do not meet the requirements for additional diagnoses such as Asperger's syndrome. To fully assess the effectiveness of pragmatic language intervention, this study aimed to evaluate whether pragmatic language therapy can be utilized to increase communication skills within children with diagnoses other than PLI, such as Asperger's syndrome. As already discussed, the current study indicates that intensive pragmatic language therapy was effective with the current study participant. Future directions identified within this study include therapy conducted within the classroom or within other naturalistic social situations, and completing the Simply Social 7 therapy program within a group therapy setting. Thank you for watching. I hope you enjoyed the presentation.